Yeah, so my name is Hezron Munyakin, and I'm a pharmacy student, fifth year at USIU, and I'm also a team player at Triculture, and also the founder of Planet Wizard, which is our health magazine. Thank you.
Thank you so much, Hezron. Then I'll give the next chance to Alvin.
Okay, my name is Karani Alvin Kesa. I'm in Kabarak University. Currently, I'm in fourth year student. I'm just a member. Yeah.
Thank you. Dorcas.
I'm Dorcas Chakugi. I'm in fourth year Kabarak. I'm just a member.
Which organization are you members of?
Yeah, member of what?
Kufsa.
Oh, you're pharmacy students, right?
Yeah, I'm a former pharmacy student.
Oh, okay. That's understandable. Marianne?
Can you hear me now?
Yes, we can. Perfectly well now.
Yes, all good. My name is Miriam Mwangi. I'm a lecturer at St. Paul's University. This webinar was forwarded. I'm in a community group for COVID response. So it was forwarded there. And I'm interested in issues of medicine.
Okay, that's great. It's a pleasure to have you here with us, Marianne. And we hope we'll get to learn together and share insights on how we can address the current issues on mental health. So maybe I'll just give you guys a moment to speak about something you think is not being addressed in the mental health space before we get into our discussion on the missing link. So who wants to go first? Maybe an issue that you feel is not being addressed in the current mental health space?
Maybe I can go first. I think my issue is the support. The government support is, it's limited, and the resources, very little resources are devoted to mental health. Because, for example, if you look at Nairobi, we only have one government facility, which is the Mathare Hospital. So in case you have a child or somebody in your family who is sick, you really, it's very expensive, and this is a long-term kind of a condition. So it's like you're on your own. So people suffer in silence. I don't think enough has been done to address and support and push on those who have the family members who have mental challenges.
Okay. So thank you for that. So mainly limited government support, and then the expensive cost of care, especially for people who will now have to seek these services from the private arm or any other facility. Yes. So that's one thing. Any other person who has something to share with us? Dorcas, you have anything you feel like we need to factor as well? Dorcas Jepkogei, then we have Dorcas Kasoa.
No.
I've just joined in, so probably I would want to listen in first.
We just started with our introductions, who we are, which organizations we are part of, or whether it's students, for example. We have students as well in the meeting room. So we're having a discussion. Then Marianne is a lecturer at St. Paul's University. So we started by introductions, then we look at it in terms of what are the challenges or the shortfalls you feel are there in the mental health space now as a country.
Okay, I could delve in.
Yes.
I'm Dorcas Hassoa, a clinical psychologist working with Nairobi Metropolitan Services. Seconded through an NGO that supports issues of gender mainstreaming. A number of mental health issues keep emerging and have emerged over time. So for instance, I'll start with the program that we critically look at that has gaps in terms of addressing mental health, and that's HIV. The anxiety that starts from just knowing the status, and we call a lot of it stigma, but we've not, again, as a population, as a country, as a people, been able to break it down into understanding that the reason why a number of us will not be comfortable to go to test is because we have anxiety of the unknown. I'm happy not knowing that I will live with a condition for the rest of my life, despite the many unknown other circumstances I've been in. Then we look at our behavior and uptake of the different services. Again, the anxiety of knowing that once you go to the hospital, you'll be taken through a process, a bureaucratic process that looks at you getting to be screened. After the screening, there's the diagnosis. Then after the diagnosis, there's the treatment that follows. Just trying to translate that with mental health and the discussion around mental health right now, that even in mental health, we need to be able to demystify that mental health is not just the talk, it's the diagnosis, it's the awareness that if I have a condition, I need to have a diagnosis. And in that diagnosis, there's that intensity that will require one, either I just have talk therapy, two, I might be referred for medication to complement the behavior that I need to adjust. And three, I might need more observation. So there are times when within, again, the same diagnosis, I need to be observed in an institution or as a walk-in and walk-out. So for me, if we could start getting this discussion to that level, then we'll also help break a lot of myths and misconceptions around mental health. Thank you for now.
Thank you so much for that. Actually, that's comprehensive overview. And it's interesting that these are some of the things that we've not addressed as much. And it's where we need to start. We need to start by seeing the gaps that are existing and see how we can make improvements. So thank you so much for that. Any other person who might have something to add on the shortfalls? Alvin, you left a little bit, then you're back. Alvin Karani? Hezron, you have something?
So I think for me, what I'd say is about awareness, and guys need to be aware that they need to take care of their mental health, and it's something that can affect anyone. Yeah, so just generally awareness on mental health and how to protect yourself.
So in a way, you feel like the awareness about mental health is not that much widespread, so it makes people not take the care they need to do.
Yeah, sure.
Okay, thank you. Any other person? Alvin? Then Tricia, yes, you've joined. So we started with introductions on who we are, where we come from, what our background, then looking at it in terms of what shortfalls do we think exist in the mental health space at the current moment. So maybe you could just have a moment and introduce yourself and also give us your input if you feel there's something you want to share. Hello. Yes, Tricia? Well, seems like she's not in a position to speak up. So what I'll do, I'll dive into the whole discussion of what we were to look at today. So apologies for those who've been joining our mental health talk series. Our host for this session, that is Kevin Muriithi, is feeling unwell and he was not in a position to join in and be part of the discussion today. So with that, I'll take over and run the session for today, of which I'm trying as much as possible to make it lively, to make it be an interactive session where we bring in our opinions, our views on what's happening in the space, and probably at the end of the day, we'll be in a better position or a better state to address the issues. So I'm Odhiambo David. I'm a pharmacist by profession, and I do a number of projects under agriculture, health, and social innovation. Hezron is part of my team, and we are a team of 7. So, and we keep growing every other day because issues that affect our society and the issues that affect our access to healthcare services keep changing, keep transforming, and we have to find a solution to them. And finding that solution means we have to do as many things as we can so ensuring every other person, because we are diverse as well, gets to what they need to achieve. So that's why we do a number of programs. We have, for example, the mental health talks. We have a number of capacity building trainings, because when someone is empowered and able to achieve their own, realize their potential in their pursuits in personal development, then they'll be at a healthier state. So if we can enable them get to that point, that's a win for us, and it's a win for the entire society. So that's why a number of programs are also on personal development. For example, the Ladies Talk Forum that we have after every 2 weeks, bi-weekly on Thursdays. Starting this week, we'll have one. And then another session that we normally have is the Man Talk, another also which is bi-weekly on Thursday evening, 7 to 8. So alternate Saturday, Thursdays. If, for example, last week we had the Man Talk, the next one will be Ladies Talk, personal development and capacity building, where we invite a number of guests as well. So these are a number of sessions that we keep running. And then for next week, when we'll be having the International Youth Day, we've lined up a number of sessions as well on capacity building. And this will be one on youth and entrepreneurship. That will be on Monday, 4 to 5:30. On Wednesday, we have youth and employment, because unemployment is an issue that's affecting our well-being as individuals. So we have a number of guests as well on that Wednesday, 4 to 5:30 in the evening. And finally, on Friday, we'll have another one on youth and youth-responsive policies, and how we can be engaged in ensuring these policies, these interventions that are affecting our well-being as individuals in the society are being structured to meet our needs. They need to respond to the needs of the society. If they are not, we need to take part in such discussions and get to know how do we get engaged towards making those transitions, those transformations for global action, because the theme for this year would be youth engagement for global action. So how are we going to do the little interventions we have at our local space that will have a huge impact in the society, a global influence, and that makes us be at a better position, because when a problem is solved here, it helps another person who might not be in close proximity to us. So that's why we are working on this as a agriculture team. So as you've mentioned, a number of things exist. Welcome on board, Kevin. It's a pleasure to have you here. I just conveyed your apologies, and it's good that you are in, but I'll also continue the session. So maybe you could just introduce yourself, Kevin.
Hey guys, my name is Kevin Muriithi. I'm usually the host of this agriculture mental health talks. Sorry, I was not able to host this session today due to personal issues, but I hope I'll be able to host them very soon. I appreciate David for holding the fort for me, and I hope to learn from you also as part of the audience today. Thank you.
Thank you so much, Kevin. It's a pleasure, and it's great that the work that you've been doing has made a number of people come open up and share some of their stories. And we hope with every other day that we host them, there's going to be a change in the society, and we'll be getting better reforms in terms of access to mental health care services. So that's amazing. So as we're going to look at it from the different aspects, as I mentioned, one, there's a missing link in mental health advocacy. The issues that you've raised, for example, government support is limited, because we talk about it in terms of facilities. We have only the main hospital that takes care of mental health issues. It has been Mathare. And even last week, there's an incident that I had that was last week, but one, where a patient was being referred to go for just scans at the facility, and they're not willing to take up those services. Reason being, there's that stigma, there's that kind of association that the society has when it comes to Mathare. So are we willing to take up the services? If people are not willing, then it won't achieve its intended outcome. So when we talk about the missing link in mental health advocacy, my focus would be in terms of what is advocacy first. When we advocate for mental health, there are two different words as well. So advocacy is championing for and promoting access to healthcare services when and where people need them. So you have to champion for it and promote access to it. When we're championing, most of the time we've been having these discussions where we talk about the challenges, we create awareness about them. And after talking about them, we should be looking at improving access And that links to the component that you mentioned, Marianne. We are talking about mental health, and everybody is working towards ensuring we have a mentally healthy society, but we are limited in terms of facilities that can provide these services. So however much we advocate for them and the facilities are not there, there won't be access. Because we have 49 million with a single hospital that is specialized for such, it means we need more facilities, more outlets that can give the services. And beyond that, look at it in terms of the human resource. For example, Dorcas just mentioned she's a clinical psychologist, which is good, but the number is not as much. From the statistics that I've read, we have a limited number of specialists in the mental health space. It means even the ratio of individuals accessing services from qualified persons is lower. So that's another challenge that we have. Then in terms of the whole advocacy for mental health care services, most of the work has started in 2015 when we have the mental health action plan. That is the government mental health policy that was launched by the government in 2015. Last year, 20th, 21st November, we had the first mental health conference at KICC. After that, the task force was formed. They released their report. That was last week. That was last month, that is in July, the first report that they've published. And that report is out there. However, when you look at it in terms of the interventions that have been put in place, not much has been done. And that is where we need to ask ourselves whether in these different forums where we engage, are our input being used in ensuring there's access to healthcare services? And if not being used, what measures can we put in place to ensure they can be accessed? And two, what are the different components? What is our main goal in terms of the mental health advocacy that we have? So when we look at it, one, Hezron mentioned about awareness creation. What interventions do you guys think are there for mental health awareness creation, and why do we need it? From my perspective, I would start from the aspect of why do we need mental health services? We need these mental health services awareness creation because once you're aware of what you're suffering from, you're better positioned to take care of yourself, and you're even in a better position to seek the care that you need. So if that happens, it will be a better approach to ensuring we have access to these services. So that is one. So maybe you guys can share with me, why do we need the awareness on mental health? Anyone who has a contribution on that?
Maybe I could also mention.
Yes.
We have a skewed understanding of mental health.
Yeah.
Because most of the time when we talk about mental health, everyone thinks the person that needs to go for a checkup is the extreme part of mental health.
Mm.
And that's the other discourse that would want to demystify. That becomes actually a critical need for advocacy, such that one of the speakers also mentioned that it starts from just knowing that I'm well, that my mind is sound, and what is sound. So helping people understand the different, the long cascade along health, wellness, and mental health. Mm. From the WHO, probably definition of what is health. Mm. Thank you. Back to you.
So when we look at it in terms of health, it's not only the absence of a disease. When we factor mental health is anything that might affect your functioning, ranging from doing what you do every other day, waking up from your bed, taking a shower, living your life normally, feeding, anything. It's not only the presence of a disease, but anything that compromises your well-being as a person, how you relate with people around you. So if you're not in a position to relate well with the people around you, then it's kind of something that contributes to your mental wellness. So that is something that is factored under the mental health. So awareness needs to be created, actually, as you mentioned, Dorcas, in terms of ensuring people know what's the scope of the mental health that we're talking about. It's everything and anything that affects your functioning. And in mental health, we look at it in terms of affecting you as a person. You're able to realize your potential. One, beyond realizing your potential, you're in a position to contribute to your society. And you're able to function as normal as you need to be. For example, you've been doing your work, you're able to go back to your work, you're able to relate with the people in your surrounding, and you're able to cope with the normal stresses of life. Because we can't say that the stresses of life will stop. towards the end of the month, for example, let's say from the COVID situation, when COVID started, some people lost their jobs, some people had to undergo pay cuts. The tension, some people became ill with COVID or their close relatives got infected. And that is a stressful situation. So how you cope with that is dependent on how mentally healthy or well you are as a person. So that's the whole scope. And I think it's a very critical thing that you've mentioned. People need to know the whole scope of what mental health covers and why they need to get checked up or even get counseling services to know what they're feeling, how they're feeling, and how to cope with the feelings that they have. So thank you for that, Dorcas. Any other person? Any other person who has something to share? Kelvin, I saw you raised your hand at some point.
Yes, David. To add on what Dorcas said, I think there's very great importance to raise awareness about mental health, especially among the youth, since let's say we have the most affected, and raising our voices, we need to create a safe space where we can share our issues, we can deal with our issues, we can talk to people who can maybe refer us to a professional who can help you with your issues and what you're going through. Because today I was discussing with my brother about the late Avicii. The guy, he had made it, he had money, he had wealth, he lived the life people would want to live. And yet he lost his life to suicide. He was depressed. Same case to the guy from Linkin Park. He sang about his depression, but no one paid attention. It was like, okay, he's just singing, he's just expressing his feelings. No one helped him. He lost his life to suicide. But there are these signs and people don't notice them. Like you just overlook, we tend to overlook them in just assuming it's sadness, maybe they have mood issues, it'll come to pass, but maybe that guy is suffering. Maybe you just need to listen to them. And when you raise awareness, you'll create an environment where someone can share their issues and you won't be stigmatized. People will listen to you and will be willing to offer help.
Thank you so much for that, actually, Kevin. It just reminded me that when we started our initial work on mental health, this mental health discussion, it was on 26th April 2019. And that was to commemorate the passing on of Avicii, Tim Bagling as is the official name, but everybody knew him as Avicii. This guy lived the life he wanted to live. He did the best in professional life, but at the end of the day, he was depressed. He had mental health issues, but the society didn't give him that much support as he needed it. At the end of the day, he had to succumb to a mental health issue. So these are some of the things we need to talk about it, because it might not manifest in how we appear out to the society, but it's something that needs to be talked about, and people need to be aware. It doesn't mean that someone, when they're thriving in their life, in certain area components of their life, they are at the best of the states, because that is a different thing. And people need to acknowledge that. For example, someone doing their job, they might work perfectly well as they need to. They achieve the demands and what is expected on them as their job, like delivering on the deliverables, which is great. Reason might be this person doesn't want to compromise on their care for their children, their family. So they push themselves beyond the limits to ensure these people can afford their meals, can afford everything they need. But is it really meaning that they're well? It might not be. So it means that even that person, where they are at their best potential, needs still that extra care, that support they need when they're feeling not okay. So it's one component on why we need awareness about these issues. So there's need for that awareness, and I'm grateful and glad that we have a number of people, a number of initiatives in the space who have been keen on improving access to mental health information. We can start from basic needs, basic rights, Cities Rise, Alfajiri, Nzumari, a number of organizations, Mind Your Mind, Nijali. So these are all organizations that are creating awareness on mental health. So that's a very important thing that we need to acknowledge. And other than that awareness, there's stigma that is associated with mental health. And as you guys were giving your initial submissions, we realized that somebody would rather stay with the unknown other than knowing that they have a mental health condition, because it's easier to stay with something you don't know than staying with something that you know about and you feel society has a different perception about it. So it means this stigma exists. It's affecting people accessing care, because before you are diagnosed, there's no way you can know whether you are sick or not. And you can't be diagnosed unless you seek care. So living with the unknown because it feels safer and more comfortable, it's affecting access to mental health care services, and means this is a component that needs to be addressed in the mental health advocacy work that we keep doing every other time. So that aspect on stigma. And stigma, as I earlier mentioned, there's institutional stigma where you're not willing to, one institutional stigma can start from an institution or an organization where you're part of. People don't consider mental health as a critical issue and nobody wants to talk about it. And if that's the case, then it means when you're working with that organization, it's not easy for you as a person to openly speak about what you feel, how you feel it, and that affects the quality of care that you have and affects your overall functioning as a person. That is institutional in one component within the organization where you work. Institutional stigma can also be in terms of the institution that I mentioned, Mathare Hospital. When you are late, let's say you are on public means along Thika Road and you are late at Mathare Hospital and you're moving in, even in the bus, you'll feel like people are looking at you because you suspect, wait, do these people think I have a mental health problem? So definitely, not many people would want to go to Mathare. And that's why we need to diversify and even destigmatize the issues on these institutions. Let people see Mathare as just a hospital where people seek care, and mental health as a disease like any other, like malaria, like HIV/AIDS, like diabetes. It's a disease and it's an illness, or you are unwell and you need to be taken care of to get better, for those who can get cured. And if you don't get cured, you need the support to live your life meaningfully until the time that your time on earth will have passed. And that will be good enough because you will have lived a reasonable and meaningful life. So that is another aspect on stigma. Then there's that stigma where there's discrimination against individuals who have a mental health problem. And that means accessing opportunities, for example, employment opportunities, being welcomed in certain training institutions is a challenge because they can't be integrated or incorporated in such a system. That is stigma that's affecting these people because they're discriminated based on that decision, that condition that they have. They can't access the quality of care they need. So that's another thing that needs to be addressed. Unless it's addressed, this person not being able to attend schooling, it means they cannot get the care they need. They cannot achieve their potential. For example, if they were to get to a particular profession, without the initial training, you can't get to that. So how do you make it to that point? That needs to be addressed. And the last form of stigma that I acknowledge that not many of us talk about is self-stigma. You discriminate against yourself. You feel bad about yourself. And when you feel bad about yourself because of a condition that you have, you're not willing to open up and talk about it because you feel like it's a disgrace to yourself. And that has been something that has been addressed. Self-stigma has been addressed when you talk about menstruation and menstrual hygiene for the ladies, because ladies never wanted to talk about it as much because it's something that people feel like you're dirty. It's not something that's a bad thing. It's a normal human process. And that is what we also need to consider when we're talking about issues on mental health, where someone feels like they don't want to let any other person know about their condition because of the fear that they might be judged against, because that is self-stigma. And when you keep beating yourself up, you're not able to function where you needed to seek support and cope with the stresses in your life. You don't reach out and ask people for the support. And when you don't do that, you're not able to realize your potential. You're not able to thrive in your current state. So that is another thing that I feel it's not being addressed. So maybe you guys, I'll give you another moment to give in your contributions on what you feel we can do about stigma and stigma around mental health, stigma and discrimination around mental health. In the meantime, we have people following in on YouTube, on Facebook as well. So feel free to type your questions and comments on the Facebook Live, then we'll respond to them. Thank you. So anyone who has something to share? You can unmute your microphone and speak up. Or if there's something that you feel is not clear as well.
I just wanted to chime in as well,
Yes.
David.
Yes. Because
That we have grown up in a society that has this narrative of being strong. And in that narrative, then seeking for assistance on how to deal with your emotions or feelings is perceived to be a weakness. Courtesy of that, again, a number of us have developed a masking where we kind of want to wish away the uncomfortability that within our definitions then, and the WHO definition would be a mental health discourse. And what we see eventually is we have childhood traumas or continuous experiences of trauma that are masked in the hope that they'll go away, in the hope that we'll develop resilience. Now, the other thing we need to understand, it's not everyone who's likely to develop resilience. And even when we talk about developing that strongness, which is resilience, we all do not just bounce out without having some form of support. So then when we are demystifying that, we would want to create awareness for people to come for screening, for people to seek professional support, we are not walking away from the African narrative of being strong, but we're also appreciating that among the strong, we have those of us who would also want to be guided. So basically for me, just to also bring that into the discussion. Thank you.
Hezron, I feel you had something as well.
So yeah, mine is just about the issue where they usually say that mental health is usually, it's something that comes up while you're still young and it grows until somehow it just explodes when you're grown up. So I wanted to ask if primary and secondary boarding schools have access to such mental health information, because this is like a stage where we all pass through before we get into university and become adults.
So access to these services and this information in primary school and high schools, definitely. Personally, from the way I was raised, I schooled all my life in public schools. The CDF sponsored primary schools. Moved to high school, the same, set up in a public high school. And I studied in my university is a public university. And all through getting into the mental health space, it was through forums that I engaged personally, personal initiative. That's one. There was never a lecture or a session that you're talking about mental health, except for now the coursework where you're in pharmacy, you need to deal with mental health diseases, look at the management, pharmacotherapy, and all that. So that is because it's part of my course and as a pharmacy student. Other than that, I don't think there has been much. In the current space, I've realized there's some organizations that are focusing on that, which is a good move. For example, I can mention Amazing Minds Africa. They started in KU in 2015. And Amazing Minds from 2015 to this date have started even having trainings on mental health. They have group activities, such kind of team buddy groups and all that are creating issues of awareness on mental health. And now I realized last week, but when there was a post that they've even engaged with Chuka University. So there's some progress that is being made. And if there's some progress that is being made, it means people as a society, we've seen the value of what we can do. So that's something that's there. But we need to ramp up that kind of advocacy and seek how people can get access to these services in primary schools, high schools, and even in the universities. Because when you look at it, let's say from the whole scope of the people we feel like have had mental health problems, we normally identify them when they are either suicidal or homicidal. At that point, that is when we realize, oh, this person was suffering. And most of the cases that we had in the recent year have been people within universities or people who are just the young people majorly. And even in primary school, we even had a kid of 10 years old committing suicide last year. So those are some of the things that need to be addressed. And I feel it's our responsibility to look at it in terms of how do we put in place such structures to cater for them. Then also seeing you have a comment here, bullying experiences that children go through. Yes, So in that kind of a bullying, we look at it. For me, what I would take in terms of mental health generally, we have it's a medical condition. It's the social determinants and the contributing factors from the society. So the social contributing factors, the social determinants can be example issues on stresses that are contributed by bullying, the tough economic situations for some people, relationship failures, that is poor negative relationship that we build with one another, they're also affecting us. So it's a myriad of factors, and the main aim on how we can drive advocacy is to ensure, one, people can address the social determinants. If there's bullying that's contributing to it, how do we end that cycle of bullying? And even now with online media, social media and all, so many people, there's bullying online every other time, and you understand, you see how people, they've stopped having any discussions online, they even like deleted all their accounts because of the stigma, not stigma as much, but the bullying that came associated with what they had posted earlier. So if such kind of things are happening, then we need to address the underlying factor, the social contributing factor. We are mean as a society. How can we address our meanness to ensure we are kinder to one another, we are offering the support the society needs, and when people can access that support, then we won't be having the mental health conditions that are attributed to such kind of stresses. That is a win for us. Then the ones that are medical conditions that exist without any other contributing social determinant, we improve access to care. We eliminate stigma that's associated with it so that they can seek care they need. That will be a progress. And then we lobby for increased investment and support for mental health services and care. That can be through government facilities being established. The private sector has a role to play. Are they coming up with hospitals? Are they recruiting the right qualified professionals? And when they recruit them, are they giving them the motivation to do the work with passion and commitment to service to the society? And once that is done, now the cost of that care, are they affordable? Insurance facilities that are coming, how do we cater for these? So those are some of the things that I feel also can be factored in. And it will be upon me and you as people within the society who realize that there's a need to address these issues, and we move towards addressing them head on. I hope that has give you some clarity on what we're looking at, Hezron.
Yes, thank you.
Thank you. Any other person have something to share? Well, okay. So if there's nothing to share on that, Kevin, I see you've raised your hand.
Yes. On the issue of stigma, personally, as Dorcas said about there's the narrative in our society about getting strong, being, and you should handle issues on your like on your own. You don't have people to support you so that you can show you're strong. Personally, if what I would suggest is, let's say someone has suffered an episode of depression. In their management, I think you should consider all factors, like also maybe it might not be necessarily as a result of family or friends, but it would be easier if we were to involve them, like make them understand, make them part of the healing process. And as much as you have to be strong for yourself, it's easier when you have people who support you, people who are there for you, people who will always check up on you and make sure you're okay. You'll feel like, yeah, you're almost there, and you'll feel better. You'll be more motivated to get better than when you're struggling with issues on your own. You're just there living in the world of your own, because society expects you to be strong, expects you to show your strength, emotional strength, by standing on your own. And talking about other issues here, also I feel that if you don't raise awareness in the society, people won't understand you. People won't understand what you're going through, and it's difficult to relate to people who don't understand you. You can't talk about issues when you feel you're being judged by person. For example, like they are talking about primary schools, about talking about bullying. People will when you talk, it seems like a normal thing. It happens, like it has been there, but it affects someone emotionally, and we are not the same. People are not the same. People don't react to stresses the same way. So don't. It's very important to have measures to help fight such. To help people with such situations.
Yeah.
Thank you.
Thank you so much for that. And actually, it's something that's very important when you look at it from how Dorcas brought it in, and then now Kevin, the other components that you're bringing on the same discussion around. There's that stigma, there's the perception that society wants to be strong, building resilience. For you to build resilience and be able to cope with the normal stresses in life, you need support, you need guidance on how you can build that resilience. Some will need it as much, some will get the guidance from their experience and their perception, their views on what the society does in different circumstances, and they get better at it. But what about people who need the extra support? What about people who need the extra care? We need to create avenues for people to build that resilience, because we need everybody to be resilient, but it doesn't mean that they'll do it without the support. It's the same way in our schooling programs. There are people who need extra tutoring. There are people who will learn, fast learners, they learn by just a lecturer giving a lecture on the same subject, and they're good to go. There are people who will have to go extra mile and review those materials that were shared as well. So we have to acknowledge the diversity, as Kevin has mentioned. We are different people, we have different experiences and different responses to different circumstances and situations in our societies. And when these different circumstances come into play, our responses can be supported by other people so that we emerge out of that not so good experience, better people with resilience and able to cope with other circumstances that might be associated with the same. But if we don't offer the support that is needed at that point, then we are losing the battle as well. So it's very important. And now on that issue as well, on acting strong, being strong enough to live by yourself, men are most affected, and society has always talked about it. And this is something that needs to be addressed. Yes, you are strong because you have a responsibility, even from time immemorial, when we're talking about the gospel days, the religious aspect on it. You are man, as you are the provider, you are the caretaker, you are the leader in that kind of any setting that you are in. Are you able to be the leader that you want to be? And are you enabled to be that leader? So those are all factors that are coming in. And the pressures, when they come in, you want to act strong, you want to act like the leader, the caregiver, but you are dying within yourself. And there's somebody who told me something recently. You can't pour from an empty cup. You can't fill from an empty jar. So you have to be full first. And that is where now, for men to be resilient, we need to build one another. We need a society that is responsive to enable us thrive, to be able to be provider. I can't provide when I don't have what to provide. But when we are united as a society, we support one another, we build a society that's responsive, we are able to be resilient. We are able to serve our needs. And when we're able to perform our needs, we feel like that sense of satisfaction that comes in when you've achieved your goal that you set out to do. So those are some of the other things that we need to factor. So as we look at all that scope on issues that we've talked about are missing in mental health advocacy, so much work has been done, and there's still so much work that needs to be done. And that needs to be done in terms of awareness. What I feel like, as a society, whatever it is that we're doing in the mental health care space, we need to factor in our ultimate goal. What is the goal of this work that we're doing in mental health? Creating awareness, providing access to services and all. One, we do the work because we want to have a healthy society. A mentally healthy society can only be realized that when we know it's what we need, and there are different factors that is making us not be healthy. So these different factors can be the societal issues, personal factors like in the family structures, and all that. So once we know what's making us not be healthy, we sort that problem, and then it gives us a platform to attain the ultimate goal of being healthy. So that is why the social determinants of health need to be addressed. Access to education, economic empowerment, support programs on capacity building, we need to factor those in our response mechanisms. And once we factor them, we are addressing the contributing factors. When less of contributing factors, cases will also decline. Two, we are championing for, meaning we are promoting that awareness, championing for it, and promoting access to care. We need to promote access to care by ensuring that care is available. we need to create awareness so that you can go to a hospital and get the care. But which hospital do we get the care? We need to ensure that those hospitals are there. And that is where even our advocacy work needs to factor in ensuring we have, for example, the primary health facilities. Now we have the Kenyan structured system where we have from dispensary, community health centers, the sub-county hospital, the county hospitals, up to the national referral. In the whole chain, do we have mental health services being offered? If not, we need to advocate for that. Have a counselor, have a psychologist in these different facilities who are trained to deal with people who have issues, who have these mental health concerns that need to be addressed. We factor it by ensuring access to care is there. We are better off addressing the mental health issues. That's one. Beyond ensuring there's access to that care, affordability. Do we factor it in the UHC package? It helps NHIF insurance, the insurance of the different from insurance companies, let's say Jubilee, Britam, and all the other medical insurance agencies. Do they factor mental health services? And if they do, where do we access them? Because you might insure me as an individual to get access to psychotherapy, medicines and all, but they are not available. So you're insuring me against something that's not there. I'll be paying premiums, but the premiums are not serving a purpose. And that is one thing also that need to be factored. And beyond that, we need the multi-sectoral and multidisciplinary team, multi-stakeholder involvement. When Dorcas gave this outline in terms of the mental health aspect, so what she mentioned was, one, you need to be diagnosed. It means you have to go to a hospital. The hospital need to have the services. Once you're diagnosed, there's a range of support systems or the care mechanisms that are in place. This will start from like psychotherapy, that's the talking to you, guiding you on how to cope with the behavior change and all that that's associated with your condition. If that's not working, an additional intervention medicines. Medicines are developed by pharma companies. How do we engage them to ensure whatever products they're producing are ideal for the people who need them? They need to be part of the process. They need to be solving a problem that they know how it's manifesting in the patients. So we as individuals in the mental health space, we need to bridge the link and bring them together. In the social determinants, ministries are there, different agencies that are addressing them. For example, nutrition issues, we have issues on employment, job creation, so many factors, even environmental factors, environment, we're talking about climate change and all, which affects how we cooperate in our environments. The cold is too much, you don't feel like doing anything and you are depressed. It even compounds on your existing challenge. We need to ensure that we call on every other person to play their role and be part of the discussion that they need to be driving a change in the society. That's a very important thing as well. And beyond that multi-stakeholder engagement, we need to drive it from looking at it in terms of what mental health facilities do we have, whether private or public, what structures do they give, what are the quality of those services. Quality services can be attained only we have qualified professionals offering quality services, and they're motivated enough to be able to serve that community where they're working. If they're not in a position to do that, we'll be talking about access to mental health services, but there's nobody to offer them. And the people who are there to offer them are doing it for the sake of just let them move on and continue with their lives, because you feel like you're not in the best state as a person yourself. And when you're not in the best state as a person, you're not able to offer the best quality of care you need to do. So those are all challenges that we have. So the whole society needs to be driving the agenda. We need also to acknowledge that these things have to happen. And all talk without action will only fail us. As a country, what I've acknowledged is there's so much that has been done in the recent space by people advocating for these services, but we say we are advocating for access to care, but nobody is telling the government to build a hospital. We're talking about access to care, and nobody is looking at the medicines component, which pharma companies are involved in this space, and how can we bring them into the discussion to ensure we can access the medicines cheaply, which means even with insurance, the insurance companies will be willing to factor it in the scope of cover that is given. Those are discussions that we need. And once we do that, we'll be far much ahead in solving our problems. And then the society as a whole need to accept that mental health is a disease like any other. It's a process of life, and how we deal with the different processes that come into our life is dependent on our environment, our acknowledgement of it, and the support systems that exist. Once that is in place, people will be willing to take up the services. The services will have been established because we've advocated for them to be available. When someone is willing to get the services are there. It's a full supply chain process. The demand and the supply curves meet, and we're able to have the ultimate goal, a healthy society that has access to the mental health services they need, making them be able to realize their potential, cope with the normal stresses of life, contribute to their societies, and lead meaningful lives. And that would be the best kind of a state that we can be. And I hope we are all ready to drive that action. So that marks the end of my discussion today. And I'll let you make your contributions or any questions that you have before we end our discussion. So back to you. Anyone who has something to share? And I'm going to give everyone a chance, maybe just a submission on how the session has been to you, what you would want to discuss again. Alvin, I'll start with you if that's okay.
Okay, can you hear me?
Yes, we can.
Okay, for me, I've learned a lot. I've learned that this disease, we should treat it as any other disease, and we should learn to educate people more so that they can know that this disease is there. And while educating them, we should pass the facts. We should tell them that this disease is there and there is a management of it, so that they cannot shine away and die with their problems. So also I've learned that when you educate, you increase the chance of early interventions, as in the person cannot just stay there. He doesn't know what's going around. So while you educate, you give them a chance. When they face such situations, they can seek for intervention earlier, which means that they will recover much faster as compared to those people who don't know what's happening. Also, I've learned that we should support those people that are facing these problems. By supporting it means that we just respect each and everybody by whatever is facing. We should handle them with dignity, with respect, only that.
And I'm glad that you've learned and you see there's some interventions, that's something that we can do at our personal level, which is a good win for everyone. Dorcas? Yes, Dorcas. Or Kevin?
Oh, yes, David, I'm here.
Yes.
I think I would say, oh, sorry, I joined the session late. I apologize. I don't know what you had discussed earlier, but from whatever I've gathered is, yeah, there's a missing link, and we all have a role to play to make sure to improve the mental health advocacy and access to mental health. One, I think raising awareness is of crucial importance. One, teaching, the more people we get to educate about mental health and mental health issues and the importance of good mental health, the better, the higher the chances of helping people, and I think the better the chances of reducing things like suicide and depression, suicide associated with depression. Also, I think the youth, us as the youth, we need to be resilient. We need to be vocal in advocating for mental health. In maybe in our own way, we can create spaces where people can talk. People can be free to talk about their issues, what they are going through, and we can be able to help each other, because it's easier to communicate with someone who you can relate to than someone else who's a complete stranger or maybe older than you, it's usually easier. So yes, that's what I would say.
We have a role to play, and we have to engage with people within our spaces, because these are people who can relate with what we are going through, we can understand us, and it makes it easier to cope. So we can apply that as people who are in this meeting room today, who are discussing this, build a safe space for another person who needs it. And when that happens, we'll have won the battle against mental diseases. So Dorcas, you've raised your hand.
I want to appreciate this platform. And the discussion has been very sober in terms of looking at the different layers of advocacy and awareness. I like the fact that within the discussion, we talked about the individual level and the role of the individual. We talked about the role of the institutions. And we even went ahead and looked at the policy and how the policy communicates in terms of how we access services. So my prayer is we continue having this discussion, because advocacy is not a one-day event. It's a continuous discussion. We are here because there's been, some sort of ongoing need, and that is what has given birth to the number of discussions that are coming in. Secondly, for me, I look towards a day when everyone will be waking up the same way we wake up and you feel feverish and you automatically can start saying, I think I have malaria. So before you even think about malaria, you're like, I think I need to go and see a doctor. I look to that day when we wake up and we comfortably walk into an institution and tell the doctor that I would want to be able to be diagnosed, or rather I would want to talk to you more about how I'm feeling so that I come out of this. I look to that day when all of us are comfortable in our spaces to seek for services in that manner. Thank you for now.
Thank you so much, Dorcas. I really appreciate that contribution. And I believe we have a role and we'll play that role together. Hezron? Marianne?
Yes, thank you very much for this great presentation. I have learned a lot. Mine is a question. In public universities, do they have counselors? Because in my university, we have a counselor in all the campuses. But my question is, do students utilize this service? Are there those who are suffering in silence and they actually don't go to see the counselor? Because we have heard of these issues of guidance and counseling that was put in secondary schools, but because the guidance and counseling teacher is also, the counselor is also a teacher, a lot of students don't go to see the counselor because of conflict of interest. Now in this panel we have, in this forum we have quite a number of students who say they're in public universities. I wanted to hear from them whether they have counselors in their institutions, and if they do the students utilize this service well? And I think I liked what you presented and said for the other one, that the chain of healthcare, we need to integrate mental health, because it's like a standalone. You can only go to maybe like a major hospital like Madare, but in your local dispensary there, are you able to see somebody, if your child or somebody is displaying some kind of mental health issues? Are you able to even get assistance from your local dispensary to local hospitals before you even think about the major one? I like that one. Thank you.
Maybe we could get contributions from the people in the room, also in the universities. Are these mental health services, counselors there? Do they offer the services, and do students take up these services? Maybe I'll give a chance to Calvin. From your case, do you have such services? Then Kevin and Hezron, yeah.
Yes, in our university we have such cases. We have the mentorship program. We have the counseling. The counseling place where everybody that faces issues such as relationship problems, you can just have that problem. And also those people who have lost their loved ones. So they usually go there, it is active. And also they have linked with students, various students from various schools. So they usually contribute to the development.
Okay. So you kind of have student peer counselors as well.
Yes.
Okay. That's interesting.
So the uptake is good? The uptake of those services is good?
Yes, the uptake is good. Yeah.
That's good.
That's
for Kabarak
that's good.
University. Then Kevin?
From a personal experience, yes, in JCOD we do have a counselor, but personally, I wouldn't go to them. Reason being, yes, I was in a, let's say, maybe a dark space. Let me call it that. So one of my friends recommended me to go to a counselor. So when I went there, talking to other people who have been there, I was told the counselor who was there is kind of judgy. And me personally being told that, and I feel like I'm in this world where I need someone who can understand me, and you're going to someone who will judge you. You can't go there. So I decided to look for another option. And it happened that my friend who was we were in the same class, happened to retake a unit. So they were told they have to go to see the counselor and talk about it. According to the feedback he gave me, he wasn't quite like, he felt like he was kind of judged. Like the question you asked, the way he's talking to you, you don't feel like you're free to share. You tend to hide something. So yes, the services are there, but I think there's room for improvement. That's all I can say.
So those are some of the feedback that we have. And this means there's some work that needs to be done in terms of ensuring the services are available, one. And when they're available, the uptake has to be is definitely influenced by how people perceive them. For example, there's something that you mentioned, Marianne, about having the same lecturer who is your teacher lecturing you in a particular unit, and it's the same counselor that you'll be going to talk to, and probably you're not doing so well in their unit. When you approach them, there's that conflict of interest. And then there's this component that you brought in now, Kevin. If when someone goes to a counselor, you expect to open up and talk about your experiences because it's you who knows what you're experiencing. But that experience, for example, for your friend who had to retake a unit and probably stay back a year, repeat that 1 year academic year, they're not performing academically the way they should, and that is affecting them. But if you're not given a platform to share what your experiences are, what's that affecting you, you feel like this person already has a formed opinion and their focus is on ensuring you pass. And that is another thing that needs to be addressed. They want you to perform at optimum without understanding the underlying factors and giving you a platform to express how you feel. I think that is one thing that we have a challenge within the mental health space, and that should be looked into. So I'll give you the last chance, Marianne, as we close the meeting room for now.
Yes, I just wanted to make a correction. I think in the universities, the counselors don't teach because there is that conflict of interest. I think it's only in secondary schools where the guidance and counseling teachers, the counselors are also teachers, and that's where the conflict of interest is. But I guess they're trying to utilize well the services that a teacher becomes teacher come counselor. But I think in institutions of higher learning, normally they just counsel. They don't teach. Yeah, they don't teach. But it's very unfortunate to hear that the counselors judge. The students feel they are being judged. because in the training of counselors, that's the last thing. You're not supposed to be judgmental. You're supposed to be neutral. This is somebody, just even making the effort to go to the counselor. You're already reaching out. It's a big step. You don't just wake up today and quickly run. Somebody thinks through. So they need to encourage and really support, and even because I know there are many students who would be having issues out there. So when they hear the services were good, the students will actually be the ones advocating for, if you have a problem, please go to the counselor. They are very good. They are very helpful. So I believe the counselors should be doing a good job. And institutions of higher learning is a good ground to actually, because there are many challenges that students go through. So they need to pull up their socks. So sorry to hear the students feel judged, and they might, the university counselor is the last one you'd go to. So I wish there was a way they would know so that they pull up their socks. And yes, thank you.
Maybe before we conclude, Marianne, could you maybe give your experience from St. Paul's University? Are you involved in such counseling services, and how do you find it there?
Okay, I'm not involved directly with the counseling because the counselor doesn't teach, but I'm in the club where we encourage students who have issues to go. Many go, but I was interested to find out, does everybody who has an issue go to? Because I'm not too sure about the uptake. Maybe it's something I would need to do some research and find out whether everybody who has an issue goes. I know for academic, when you have to do a receipt, it is mandatory that you're given a letter, but to go and see the counselor. But academic issues is not the only thing troubling students. There are so many other issues. So I would really wish that students would feel these are safe places for them to go to, just to talk, walk in, talk with the counselor, because it would be very sad to lose students through depression when we have this kind of services. Suffer in silence. It affects your grades, it affects your relationship with the other students, and all that. So first of all, I would want to congratulate, at least the universities have made that step to have that service there, which is one step in the right direction. So we just need to improve, as some of the students have said, improve those services so that students can actually run there whenever they feel the problem they have is too much. I think it's a step in the right direction.
Thank you for that. These are some of the things that have been done, and it's amazing that there's some progress that is being made. The only thing that we have to acknowledge, there's always room for improvement, and we need to share this feedback with the people who are involved. And when that is being done, at the end of the day, we'll have a better state where these services are available, people are accessing them the way they need to, and it's a win for everyone. So thank you so much, everyone. It's been a pleasure having you here. The discussions have been enlightening. There's certain input that you gave in that's guiding me in terms of how we can approach the whole issue better. And that is the importance of learning with others and growing together. So thank you for now. We'll be ending the meeting. Tomorrow we have a health roundup where we'll be factoring patient responsibility in health. Because most of the time we talk about the doctor's responsibility, the role of the government, but what is the role of the patient? So that will be our discussion tomorrow, 4 to 5. And then next week, as I mentioned, we have a number of series of discussions. So thank you so much. Feel welcome to join in our discussions. It will be a pleasure to learn with you. Asanteni.
Yeah, thank you too for hosting a very lively webinar. Thank you.
Thank you. And Kevin has just shared our WhatsApp link to a group that we have for these mental health discussions. So feel free to join in.